Human behavior can often be explained and predicted by observing patterns, which are influenced by our genetics and our environment. Over time, we have learned a great deal about why people behave the way they do. But what if someone develops behavioral changes that are unpredictable and drastic? What if these changes are caused by something most doctors don't even recognize? One example of this is PANDAS, not the animal. PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcus. In other words, it's an autoimmune disorder triggered by a strep infection. PANDAS primarily impacts children, with the average age being 8, affecting 1 in 200 kids in the United States. The main symptoms characterizing PANDAS are sudden onset tics, obsessive-compulsive disorder, or both. Tics are involuntary movements or sounds, and OCD is characterized by intrusive, recurring thoughts and compulsive behaviors. If obsessive-compulsive tendencies or a tic disorder were already present, PANDAS can worsen the pre-existing symptoms. Other common symptoms of PANDAS are sudden fits of aggression and irritability, separation anxiety, or even suicidal thoughts. These behavioral changes show up abruptly and affect children, so they are understandably disturbing to experience and witness. PANDAS is triggered when the child's body fails to respond correctly to a strep infection. Through molecular mimicry, strep bacteria disguise themselves as healthy molecules in the host body and evade the immune system. When the immune system finally reacts, it also targets the healthy cells that the strep molecules were imitating. In the case of PANDAS, the immune system attacks the basal ganglia, which are involved with emotion and motor function. Children often have asymptomatic strep infections before developing PANDAS, which is why the infection often goes undetected and untreated. When diagnosing PANDAS, the first step is to determine whether strep bacteria are present in the patient. If so, antibiotics can treat the strep infection causing the symptoms. Cognitive behavioral therapy, sometimes along with prescribed medication, can help treat the behavioral and psychological aspects. In severe cases, when other treatments are ineffective, a plasma exchange can reduce the blood's antibodies. After thorough treatment over a long period of time, the symptoms of PANDAS can be reduced and usually disappear completely. However, some people with this disorder face long-term effects, and symptoms that have been resolved can often reappear if someone is re-exposed to strep bacteria. Parents, medical and mental health professionals, and educators should be aware of PANDAS as a possible cause for sudden and drastic behavioral changes in the children they interact with and care for. As more people become aware of the causes, symptoms, and treatments of this disorder, children with PANDAS will be much more likely to have the medical treatment and emotional support they need to heal.